Then notes. All right, guys. So, oh, and Raquel and Matt were going to join us as well, but I haven't seen them sign on. Okay. Anyways, thanks everyone for joining. I'm going to go ahead and get started. And we might jump around a little bit on the agenda just because when people log on, we'll start with them. So why don't we go ahead and start with Ami since she's here. And Ami is, you guys have already been chatting, so you already know her, but she and Colleen have been working on that parental survey to look at their attitude on climate change. And so I'd love to hear more about that. So go ahead, Ami.
Right, thanks. I'm going to share screen if that's okay. I
Yes.
made a PowerPoint because I can't help it, even though I try not to. Um, so hopefully you guys can all see this okay. So Colleen and I titled the study the Parent Perceptions of Environmental Sustainability in Pediatric Surgical Care. And this sort of grew out of the fact that when I was thinking about climate change, I was talking with one of my patient families about it. And it was interesting that, like, while we ask people's opinions around the United States about what we think about it, there aren't really many papers out there or many surveys that actually ask people what they think about it in terms of the healthcare environment. Like, do they even think about it? Is it even a factor? Do they want to know about it? So we, what we did is, oh, sorry, this came up really small. But I'll send out the PowerPoint and I can read the questions to you. Let me try and make it in presenter mode and see if that makes it any better. It may or may not. A little better. But what we did is we just asked a captive audience, 100 patients in a general surgery clinic while they're waiting for their appointment. Hey, do you mind filling out this survey? And most of them were bored. We have long wait times in our adult general surgery clinic, like everything else. And so they were happy to actually fill it out. And so we just, we modeled these questions off of, from Yale, they have a yearly study, I guess, that they put out every year called the SASSy survey. It's like the Six Americas something something survey. And they ask it nationwide just to see what American attitudes are about climate change. So we modeled most of these questions off the SASSy survey just to see if there's some, something that we can compare to. So we asked if you worry about the impact of the environment on your health, how much do you think healthcare contributes to greenhouse gas emissions? How likely would you be to choose a health system that's trying to reduce their greenhouse gas emissions? A very selfish question. Do you care that our institution is working to reduce our carbon footprint? Because, like everyone, I'm trying to get the C-suite to care about it. And would you like your surgeon to include environmental impact in a discussion of surgical options? Should hospitals publicize their efforts to be more environmentally friendly? And so it was a piece of paper. We gave them pens and let them fill it out. And then we just also had do you have anything else to add component of it? And it was fascinating because probably about 15% of the patients wrote like a page and a half of what they think about the environment and what is happening and all of that type of stuff. And so we asked them as well on the written survey if they were willing to get a phone call later for us to actually do a qualitative interview with them. Only, I think like out of the 100, 10 said yes, only 5 answered their phone, or I think maybe 7 answered their phone. So we were able to talk to the seven people, and this was sort of the interview guide. Does the environment impact your health? Do you think our health system impacts the environment? You guys can read this easy. But we just wanted to we had like the Likert scale, but we just wanted to know a little bit more like, what do you actually think about it? And so it was surprising. These numbers are higher. Oh, it's 5. Here we go. These numbers were higher than the SASSy survey, that 75% of patients were worried about the environmental impact on their health. 52% already had some idea that healthcare contributes to climate change. A lot of them wanted to choose hospitals that were more environmentally conscious. And they wanted the things publicized. But it was interesting. what we saw a lot, and we saw this in the qualitative interviews, they're like, yeah, we would want to know, like, if we are to choose between different types of hernia repair, between lap and robotic and open, yeah, we'd want to know about the environmental impact, but then maybe we wouldn't want to know about it, and we just want whatever's better, slash, whatever the surgeon thinks is better. And so there's like a lot of initial, yes, we want to know about it, but then a lot of backpedaling, which is not surprising. But it was only 5 patients that really answered that. Um, and obviously they cared a lot about quality of care being maintained. So we were like, well, we should ask parents this. Like, let's redo this survey in parents and see what parents think. My assumption is that parents care more about this, but that may be totally false. And so we, and also we captured all the demographic info in the adult survey. And what was fascinating to us is that people that wanted to know most about the environmental impact in a statistically significant way, even though the sample size was very small, were actually Black women. And we're not sure why that is. We don't know if that's some inherent distrust of the medical system because of what's happened to them over time in terms of a lot of racism. But and we thought we have a pretty Rush specifically has a mission, an anchor mission to take care of patients from the west side of Chicago, which are historically disenfranchised, lower socioeconomic status people. But we get a fair amount of people coming in from a rural population because we have a satellite hospital that's pretty rural. And so there's a large breadth to our population. So and we asked you if they lived primarily in a city, suburban, or rural. And the rural patients were not more concerned about it than the other patients, but it was interesting. Um, so anyways, we wanted to do this as well in pediatric surgery clinics around the country. We're hoping to get, a pretty broad snapshot from around the country. Um, and these are the questions that are currently at IRB approved. This rush here is like a star, meaning that people can fill in their own hospital names here. And we're hoping to, so I wanted to bring it here because I think these questions are probably written at too high of a literacy level. And then we're hoping once these questions were rewritten that we would also get it translated into Spanish to ask, at least we have a large Spanish speaking population, to be able to get our Spanish speaking patients as well to know what they think about this as well. We have just the demographic questions. And then I think our idea was also to do a telephone survey if they were interested. And so, we have a centralized red cap survey. And this may be getting a little bit ahead, but we were thinking that we would try to get 2 people per site, like an attending and possibly a resident fellow trainee. Recruit pediatric surgery patients while they're just waiting in the clinic, while they're waiting to be seen, and have that standardized red cap survey link that would all come back to us, and then it'd be in Spanish or English. And I realize there's some details here to work out. So I will stop sharing screen and then and then I can email this to you, Linda, and we can send it out. And I'm happy to incorporate any feedback, see what people think, all the stuff.
Thanks for sharing that, Ami. So the survey is actually just 5 questions.
Yeah.
Okay.
Uh,
And
yeah.
they're mainly yes, no questions, or are they
They're
Likert?
Likert scale.
Likert scaled. Okay.
Yeah.
Well, I did a survey on attitudes on the use of artificial intelligence in surgery, and ours was like 33 questions or something like that. So this one I think you'll have a more, I think people will be able to, or will finish it more likely than ours, which we administered like, one student with the person who agreed to interview to make sure that they got all the way through it and on everything like this. But I think this one, yeah, with just 5 questions, I think that would be good.
I have a quick question. So let's assume that you have a huge number and this has, let's say a year from now, you've got all your results. and you find out that parents are concerned. How are you gonna use this information?
Yeah. So the way that I was able to use this information in so we got this paper published. I think it's in I don't know. I gotta look it up. The American Surgeon. I can find the reprint or something and send it out with it. No, maybe it's in surgical education. I don't know. I can find the reprint and send it with it as well. But the way that I was able to use this at our hospital level was we have a quality and safety. We have quality and safety, and then we had our sustainability department that actually doesn't have any clinical partners associated with it. So by using this information and that people care about this and it probably affects Press Ganey and the overall reputation of the hospital, they've been willing now to take one project per year and make it as part of our quality and safety metrics, which means that there's money behind it, people are actually looking at it, we're monitoring it. And then it's also enabled us to find funding for a clinical partner with the green the OR stuff to be able to like make changes like this is a stupid example, but we used to order like 15 different sizes of lubricant, like from packets to bottles to like the squeezy things. And we're like, look, this isn't environmentally sustainable and this is financially irresponsible. And then we can say that we're doing something about this. And they were like, yes, do it. Whereas previous to that, when I was like, why do we need this array of lubricant? They're just like, that's just the way it is. So I think that's why there were those selfish questions in there. But I think this could obviously lead to further survey development, more questions and everything like that. But as of right now, we haven't asked these questions. So I was just like, let's start on the ground level and see what people even think about it. And that's why we have the qualitative portion, so that maybe we can help figure out where we need to focus our efforts a little bit more in terms of when we talk to parents about sustainability in surgery.
I have two thoughts on this. One of which is I thought there were surveys already out there. I don't know this for a fact, but I thought these surveys existed where parents do indicate that they're concerned about the environment. The other thing I would raise, because I don't know what the difference would be, is if you're asking the parents in clinic, it is slightly different than in the emergency room saying, we're going to do your child's appendectomy. And I'll just throw this out there. The stapler is more expensive and it's usually disposable. Therefore, would you like us to use I don't know, something that's cheaper and more environmentally friendly? It's a different scenario.
Yeah, so I think so we're actually repeating this study as well in our ER because we're like, it's a totally different thing. Elective surgery, scheduled, all that kind of stuff versus an emergency situation. So we're partnering with our ER right now to run this survey through our ER and see what the differences are. But I think the other thing is that this can help raise the like I'm hopeful that surgeons will start reading this paper and be like, what am I doing? For instance, I brought up at our hospital, like I would say we have 5 partners, and I would say like 3 of us are pretty dedicated to doing the single incision appendectomy where you pull the appendix out through the umbo. And 2 of my partners are not. And I'm like, dude, you cost so much more than us, and you're like so environmentally like unfriendly by using one of my partners who shall go unnamed, uses the ligature and the stapler. And I'm like, dude. And like he's like, well, every time I do it now, I feel guilty about it. And I'm like, okay, like how do we translate this guilt into action? But I think it's also just raising our own knowledge about it. So, that our patients care about. My ultimate hope is that we can use this in terms of advocacy because JACO has supposedly said that they have a sustainability person now and that they're going to release their own certification for sustainability. And I'm like, is there some way to have this be part of the patient experience, part of patient surveys, part of the JCO sustainability certification. I don't know. So long answer is I'm not sure exactly how we'll use it, but trying to get the data for all these things. But I'm open to anything anyone thinks.
That last part that you said makes me think of I think Sarah Greenberg, because if JCO's really going to put something in like some sort of measurement or benchmarking for sustainability, Sarah wanted to introduce some parameters in NISQIP, I think, right? And so well, more to follow with that, but if it's really going to be more of a benchmarking thing, um that would be very interesting. Now, I had a like kind of more of a, I don't know, technical question for you. On your survey, do you say anything in there as like a disclaimer, whether you do or don't answer this, it won't affect your care, and the answers that you give are not going to affect the care that you provide, that you have provided through this clinic or something like that?
Yeah, absolutely. It's like the base sheet for the consent. It says like it's totally voluntary. You can choose not to proceed at any time. It won't affect your care. All
Okay. And then for the multi-center study, were you planning on including that qualitative part?
it was my hope because I selfishly as a researcher, I think there's, it's two papers, and I think we can get so much richness from the qualitative aspect of it,
Mhm.
to really put some of these things in context. Because, like, even though it was only 5 patients, we saw them say, "Oh yeah, it's so important to me." And obviously, I think there was some, bias in who decided to say yes and who decided to answer the phone. Like they were already people who cared about it. But then it was interesting to watch them backpedal all the way to like, wait, maybe this isn't as important to me as I think it is.
And then just to follow up that, are you planning to have any sort of like training or standardization for how those qualitative interviews are done?
Yeah, so depending on people's bandwidth, the people that we had talked about with this before, people that have been on this call, like Ramin, and some of the other people, and like even Colleen was saying, like she's like, I don't have the bandwidth or the ability to do these qualitative interviews. So we definitely have a resident that's interested in it, depending on what it would be, and then we have two I forget what their titles are, but they do all the interviewing and calling all the patients, the research people who do that, that could do this, who do other qualitative interviews. So I was thinking that all the phone calls would come from Rush unless somebody was like, we have the bandwidth and the ability to do that.
I was just clicking over to the link that Alfred put in the chat. Thanks for putting that in. Is this
Yeah,
new?
it's a voluntary certification, and it's, you know, when I heard about it last year, I was hoping that maybe it eventually becomes a requirement, and there was a way for them to kind of wade into the waters of sustainability. But it's been now, I think, 2 years, but it's obviously in this environment, it's not gonna have, it's not gonna become a mandatory thing, but it's a, with HHS, the pledge and all that going away, it's one more thing that people can use.
And the other part, when we talked a little bit about it, was the political climate is a challenge, but it's also the financial impact. It's going to be the challenge as well. I mean, we all know that the hospitals and the bean counters don't do anything unless they are forced to. So the JCO part, if it's not mandated, they may or may not do it. And the other part is financial. Right now, there are going to be huge issues from a financial standpoint. So anything that costs them money, I mean, they're not going to do it now anyways if it costs money. They're even less likely to do something if it costs them more money later on. I always focus on if there's a way of saving money and being environmentally conscious, that's your ticket. Like your win is that if you can identify those wins.
Yeah, I think so. I totally agree. I know that everything that we've done in terms of sustainability with our sustainability office has been significant cost savings to the hospital. But I did sort of consciously make the choice to leave cost out of it because it is such a hot button issue. And like probably when Colleen and I were initially thinking about this study, it was right after that United Healthcare CEO got murdered. So I'm sure that influenced our decision to leave it out. But if there's a good way to incorporate it into the survey or into the qualitative questions, like, yeah, that'd be awesome. But it seems like most times more sustainable care is cheaper.
At least
Yeah.
that's certainly the case with the appendectomy example.
Does the demographic part of the survey include parental education level?
Yep,
Okay,
great question. Yes.
just since we can't be overtly political, but to counteract the belief that it's just highly educated liberal elites who care about the environment.
Yeah, that's why we were surprised at like who wanted to know the most and who most strongly indicated it on the Likert scale.
Okay. Thanks,
It
Ami.
could be a reflection of some of those communities that are most dramatically impacted by climate change, particularly urban heat islands, or those more impacted by direct exposure to air toxicants and pollutions.
Yeah, because we definitely have this area right outside of Chicago that's called the Toxic Donut, where they did like all the smelting, heavy metal stuff, and then they dumped a bunch of like really toxic garbage out there. And it's the historically Black disenfranchised neighborhoods, and like we have, we have Cook County, and we have like a another hospital that's related to Cook County, and like the amount of cancers and everything there. It's like well documented. Everyone knows it's there. Nobody does anything about it.
So as far as this goes, I think uh, Colleen had sent out a doodle poll. I don't know if she's picked a date off of that. Do you know any by any chance?
I don't think she has yet.
Right.
So, but I'm happy to send this out. Anybody that wants to be interested, anybody that wants to make these questions better. Like I said, I think the reading level is too high, so we definitely have to modify that. But I sort of wanted to do that as a group in case there were any other questions we wanted to add. But we purposely kept it short so people wouldn't feel like, oh, we're keeping you in the waiting room to do these questions or like any of that stuff.
Yeah. Okay. You can either send it to me, and then I can attach it to the minutes I usually send out a day or two afterwards. Okay, cool.
Perfect. Will do. Thank you so much for everybody for your input and listening. So I appreciate it.
Okay, then next, Grace, can you give us an update? Are you
Yes.
okay? So
Hi.
we had the paper that we submitted to the seminars on pediatric surgery.
Yes. Yes. So that is submitted and I'm just waiting to hear back. So, yeah, I think at this point it was a little unusual because we had that January deadline. And so our paper was submitted at that time. And then we didn't hear anything until the end of June, like June 25th or 6th. And got an email to basically submit it within a week to the journal.
Did
So,
she ask for any edits or anything like that on it?
no,
Okay.
but it's now, so I did get a confirmation email that the editor in charge of the sustainability issue for advocacy had received it and listed Marion as the editor. So we'll see what she says. And then I think it's up to the 16th. She may get back to us because there's like this second can be resubmitted up to the 16th, but I haven't heard anything. So just waiting.
Okay. Perfect. Congratulations. Glad that's
Thanks.
moving ahead. I know we were all kind of wondering about it,
Yes, yeah.
to and after APSA. Okay. Okay. And then so I guess next we'll talk about just kind of I have put it under the follow-up plans for APSA 2025. And one of the things was we had discussed partnering with quality and safety, the committee. And I had talked to Raquel and Matt, Raquel Gonzalez and Matt Centauri. I thought that they were going to be able to join us today, but I guess they neither of them are. But they were interested. And it was interesting, Alfred, your name came up in the discussion. And um, as we were talking, I was like, actually, I think I do know who Alfred is for Matt. And they are interested in working together. They had raised a couple of ideas of projects to kind of feature, and we were still, that I was hoping they would come today so we can talk more about like how we were thinking the session would look. Um, I think our goal was to try to reach a larger audience and be part of the main programming rather than um, kind of last day and end of the day sort of thing. So, did you guys have any thoughts about, you know, how this might look or how you want it to look? Or if you guys have projects that you want to submit that haven't been submitted as abstracts that they're aware of, if you guys have projects that you think would be good to use.
So I'm not familiar with this effort. Can you give me a little bit more background?
Yeah, so um the idea was to partner with quality and safety. So we do sort of like a combined session. And we were thinking either we do like a combined workshop idea or like a panel discussion, like a group of experts panels. And so my vision for it when we were talking about it was kind of like maybe we pick one project, two projects, a couple of projects, and somebody from our committee would discuss what the project was, maybe some troubleshooting ideas. And the quality and safety committee then would have a expert then talk about how QI metrics and maybe like implementation plans or that sort of thing can be combined and applied to like our sustainability project. So sort of like a way to help people see how they could do like a sustainability project, but not just have it be like, like a not, I don't want to, this is not derogatory at all, but like, like a pet project, but actually like turn it into like research.
I see. So you're trying to incorporate quality improvement projects, but circle it around sustainability.
Yeah.
Got it.
Yeah, at Keen Med, Ami mentioned that Colleen and Ami and I were there. This was the first time I attended Keen Med, and it was very eye-opening. But there were a lot of sessions and a lot of talk about having sustainable in a lot of hospitals. Sustainability is under quality and safety, and people who advocated for that felt that that gave them more teeth to do change to um, to make changes around rather than being like a separate effort within the structure of the organizational chart of the hospitals, and and making sustainability about performance improvement, not just about decreasing the carbon footprint and decreasing cost, like making the ORs more efficient, making the hospitals more efficient, and things like that. And and there was a workshop, if I recall correctly, about that and at CleanMed. And um, I don't know exactly how to clinically or practically approach this, but I mean, the idea that a lot of hospitals that have had advanced sustainability efforts that are incorporating it under the umbrella of quality and safety to get more pull with the C-suite was intriguing to me. So I think that starting the conversation to collaborate the two committees is a great idea. I think.
Sorry if I'm talking out of turn here, but I think there's one project that Alfred and I saw at CleanMed that might work well for this. There's a lot about microplastics, about the positives and negatives of microplastics, and making that in quality safety measure. I think that's a little bit of a reach, but one that was really easy that might be good is that there's an ENT surgeon in LA, I'm blanking on her name right now, who made a small video. It was called Gloves Off. And they basically that people inappropriately use the disposable plastic gloves all the time. And even infection prevention and control was on board. Like people are using gloves way too much and they don't need to use gloves. And they hypothesized like this may be leftover from COVID, or it just may be that like we've all become germaphobes or something like that. But they produced a short educational video that included the nurses and they showed it to everyone as part of an education thing. And then we're tracking the glove usage and they used 1 million less gloves in a year from just showing this video and telling people to wash their freaking hands. So it hit like infection prevention and control as like a hand washing measure. It hit quality, and then it hit the financial bottom line, and then obviously sustainability as well. So that might be one that highlights all those different components.
That's a great project.
And that's it's a low-hanging fruit relatively because it's just like an awareness campaign. You don't need to invest in anything and you don't need to like accept just raising awareness. And yeah, I mean, that was a great idea.
Are you guys able to share the video? Do you guys know where we might be able to get the information that they used for that?
I think I have it somewhere. I can look it up. Yeah.
Yeah, I definitely have her name, and have the infection prevention and control person that she's working with too. So I can look for it too, Alfred, in case you can't find it.
Okay.
Ami, do you know if this was done in a clinic or clinics or in the hospital?
The lady who championed it is ENT, and she started in her clinic, but it spread hospital wide. So it was at, you know, it was in California, so it's one of the big healthcare systems, one of their feeder hospitals or whatever. But they did it throughout the entire hospital.
Yeah, somewhere in the Central Valley, they started in the clinic. Yes. Mhm.
And they measured it over 1 year.
Mhm.
So the reported outcomes were from the hospital, not the clinic, or both, or maybe.
I think both. I know the NHS has a pretty strong gloves off campaign as well. So we could even draw that the NHS is doing it and they have some robust data around it. Um, but I don't know. Alfred may remember better than I do.
And it's got something up in the link. Is this it?
I think that's
No,
from
that's the NHS. I couldn't find the Central California study.
Oh, but that's still.
Yeah, I'm looking it up. I'm looking it up. Yeah.
Well, I
But
wish
there's a lot that comes up from the NHS and their experience.
okay. I wish Raquel or Matt were on so they could like, maybe like take like this sort of idea and see what they can play with to generate like the quality improvement aspect of it. I mean, like, I think all of us can think of like quality improvement. And Ami, you already came up with pointed out a lot of the ones that they were measuring pre and post and maybe like different ways to implement it and the different kinds of outcomes that they were looking at. But I mean, this is kind of Ken, kind of like the idea that we were thinking about to have like a sustainability project, but then sort of emphasize how it can be done under a quality improvement, efficiency improvement, safety, that sort of thing. Okay, so let's talk.
Sorry, just quickly, I put the link to the article, but they looked at carbon dioxide emission decrease and then compared it to carbon equivalents. They looked at total number of gloves, kilograms of waste, and cost savings per year were their outcomes.
Maybe they should also look at how often hands were washed. But okay. So let's talk about this more at our next meeting. We only have 8 more minutes left because I started late. Okay, so our next big topic then is advocacy within APSA. And there was a lot of emailing back and forth with the carbon offset credit. and that was mostly between Colleen, Sarah King, um, and they um, I think it was also, it may have been Clean Med or Meet Green. Um, there was a contact that they were emailing back and forth, and maybe we can get them to join our next meeting. But it does, because one of the questions that we had brought up from the last time is how are we going to get these carbon offset credits for APSA registration if this is the thing that we want to propose to the APSA board. And it seemed like with this Meet Green group that they had some potential solutions that I don't know if they're exactly like out of the box sort of things that we can right away plug and play into, but um, it did seem like there are options out there. So I'm sorry, I don't know if it seemed like Colleen or Sarah would know more about it, and neither of them are on. But we can talk about it more at the next meeting.
So just as a quick aside, if you can fill this question in, but so this would be something that the registrants would pay for, or who's paying for the carbon offsets?
The people who are registering at the end of the registration,
Yep.
you've like decided if you're going to pay for your spouse, you can decide if you're going to pay for the Benji Brooks and
Mhm.
all sorts of things. Then there's like, an explanation about our interest in sustainability. And if you want to cover the, you know, carbon offsets for your travel or for the meeting, for your portion of the meeting or something like that, then you purchase the carbon credits from there.
So for example, if someone's flying in from New York to Chicago this fall or next spring, like is it based on if you're flying from a certain distance? And let's say someone's flying from Alaska, the Alaska person's gonna pay more. Is that right?
Yeah, something like that.
Interesting. Okay. And
Yeah, Clean Med had something like that. uh, As far as the food that you want to eat, if you avoid meats, then you decrease your. So you sign up for just vegetarian meals, and
yeah.
whether you want to pay off, you offset your carbon footprint and things like that. So
Alfred, did they have a difference in the distance travel to reach Clean Med?
honestly, because it was in Atlanta and I just drove, I did not. I don't remember that. I didn't look at that, but I did sign up for vegetarian meals at the conference. But I don't know, maybe Ami or Colleen is not here. But Ami, do you remember?
The about the food.
No, the travel to Clean Med. Wasn't
Oh,
there an option to do an offset?
there was an option to do an offset, but one company ended up agreeing to offset everyone's carbon impact.
How do
So
you mean?
you could individually choose to do it, but then they were like, exciting news, one of our vendors agreed to offset everyone's carbon impact. So we may be able to get one of the companies that's doing something there to do that.
So for
Or a medical center? Yeah.
so how
Okay.
much money are we looking at? Like, yeah, of course, everyone when they're looking at their money, if it's a small amount, they're probably more willing to pay that. But if it's a large amount, it's less likely for someone to pay. Are we talking $5 or $100?
So the only background that I have for this is when I bought the ticket for Montreal to no, New York to Montreal, I remember that there was a carbon offset credit for that, and it was about $20.
From who who had the carbon offset?
Air Canada.
Interesting.
Yeah.
I did not even know that. So where did that popped up when you checked out or something? Or
I bought the ticket through United, and then they were like, "Oh, we're partnering with Air Canada," so the actual ticket was through Air Canada, and that's where it came from.
interesting.
Yeah.
I have never even heard of that. That's great. Maybe my head's been stuck underneath the sand or something, but I had never even heard about that. That's great.
Yeah. That's the only time I have seen it in my traveling and going around to different meetings. But yeah,
So it was $20
yeah,
to Montreal.
20
Okay.
20 can't remember exactly, but it was 20 something.
I'm just getting ballpark
Yeah,
ideas.
but that was just a trip, right? And so yeah,
Yeah, there was nothing for.
yeah.
A,
It's
a lot a lot of the airlines will list what the carbon offset is
Mhm.
before you buy it.
Yeah, I just have never been offered the opportunity to purchase carbon offsets. I mean, I've seen the thing about like Alaska Air will say, this is how much it costs, in CO2, but I've just never been offered a carbon offset. Maybe I've been missing it all and skipping it. I don't know, but I've never even heard of it.
Okay. Did anybody else see it, or am I going crazy? I'm pretty sure I remember it because I was like, oh wow, I could purchase the carbon offset. Oh, it's only $20. Oh, okay, it's not as bad as I thought. So, okay. I think last time we met, we were talking about what we thought that the range of it was. And I think we were looking it up, and it was something tens, twenties of dollars. Some it wasn't like hundreds. That's what we were worried that it was going to be. Okay, so then let's see. I was just looking at my notes about this, and um, yeah.
I wonder whether the hotel that we're working with in Chicago has anything that they're doing. Off the top of my head, I can't remember what hotel we were staying at, but it'd be interesting to see what we can do to partner with them in some way. Again, I can find out the hotel.
Yeah, that would be great. That's our next other thing, making changes at the future APSA meetings. So
Yeah.
Sarah King was definitely still very interested in not letting that go. So Ken, if you can, because I haven't seen any information. If you can let us know what hotel we would be staying at, then we can start to contact them and see what their green status is like.
Yep.
It looks like the Grand Sheraton Chicago Riverwalk.
Okay.
There you go.
Grand Sheraton. All right. Because some of the ideas that we had was, setting up a way, or maybe asking the hotel if they have shuttles to bus people back to the airport at the end of the meetings. We're thinking that, people come in at all different times, so that's probably not going to work out. But like at the end of the meeting, most of the time, people are often leaving at around the same time. So trying to decrease carbon footprint there. Um, Setting up trash or recycling bins and see if the hotel already has that there, and doing a vegetarian meal for option. We having a vegetarian meal option, and placing a bin to recycle badges and lanyards at the end of the meeting. I mean,
composting is
oh, sorry, go ahead.
also composting the food, that adds up.
Yeah. Oh, what I was going to say is even if the lanyards are sponsored, that's what Colleen was saying, that the lanyards are probably going to be sponsors, or they're printed with like, a specific name on it. But the plastic part of the badges may still be something that can be collected and recycled or reused. Okay. Okay. It's 8 o'clock. I think that's pretty much everything that I wanted to get through to. I did want to touch a little bit about any projects that we as the sustainability committee can do to kind of jump in with the advocacy committee in general. Um, the push with Dr. Hayes Jordan's focus for her presidency. We wanted to use whatever resources we had. I don't know if anyone had any ideas that might meld with her specific mandates that she had.
I mean, if I'm reading in between what she would like, her goal is primarily to act as a resource and data collection. So if there are ways of providing data to others so that it could drive advocacy, I think is kind of her goal. In other words, if you say, if you can reduce carbon footprint by doing XYZ in the operating room, then that will be highly beneficial to the environment. I think that would be helpful data. Again, I'm kind of interpreting a little bit about what her goal is in terms of advocacy, but that seems to be what her push has been, which is to be the information source to drive policy.
Like ever since the very beginning, we've talked about pooling data and pooling research and stuff like that. And then I've kind of dropped it off the agenda because we didn't really do very much about that. But um, is there interest across the committee to do stuff like that? Kind of like what Ami is doing with her survey across many institutions, but like pooling data on your greenhouse gas reduction projects. I think a number of you guys have projects going. Would it make sense to pull the data together? Maybe if you guys have similar um projects.
I mean,
And what would,
it'd be interesting to get Dr. Hayes Dixon's specific requests, but I mean, I think she's kind of looking at a higher level in terms of um, impact.
Mhm.
Um, I don't know.
Yeah. She wanted to look at, we were thinking like disparities would be the most likely area that sustainability might impact or might affect, and that there might be a difference in um, sustainable or really, really unsustainable practices like polluting practices.
Yeah,
Uh,
I mean, as I hear what she has said in a couple meetings, I'm going to make this data up. I don't know of any existence of this data, but it's like if you can decrease CO2 emissions, you will save 100 lives. Something to that effect, where it has to have an impact. And again, I'm interpreting what she's saying. I could be totally off base, but in what I've heard her say, I think she wants to have the sound bites. I think she wants to have the info that might alter someone's decision-making process.
I think there is data in pediatrics in the asthma world and respiratory diseases world, and especially with disparities as well. But I don't know if I've seen data in the perioperative world.
I certainly haven't. Again, I haven't looked hard, nor am I creative enough to actually come up with data like this. Um, but again, I'm interpreting what she's saying, that she wants to have information that might move the needle on a politician's decision-making process.
yeah.
Yeah, that's a big ask
Why?
for,
I don't
yeah,
dispute that.
yeah.
I
Well,
read
because
it. Yeah.
in OR, in surgery, we're not trying to hurt anybody. We're like obviously trying to. We wouldn't. It wouldn't be like we were giving inhaled anesthetic gases, and one of them causes like lung cancer, and the other one, we try to do stuff that are safe.
Well, I mean, so let me make, again, I'm going to make up data. Like if you stop isoflurane use, like how many interpreted lives would you save from that? You know, again, I have no idea how you're going to actually come up with this, but that's the kind of, I imagine, what she's kind of looking for.
Mhm.
Again, this is kind of soundbitey, but sad to say, but our politicians are soundbite, like very short attention span, make it easy so I can understand kind of deals. I mean, we've all sat in front of politicians, and we all understand that the politicians are what's going to make me look good, what's going to make me reelected, what's going to get me campaign bucks. I hate to say that's true, but I think it is. And I've sat in front of many politicians, and I think that's the reality.
Yeah. All right, guys. Well, we're not going to solve that problem tonight. Thank you all for staying late, and I'm sorry that our meeting started late. We'll go ahead and
Okay.
stop the recording.